Cardinal venous system is thought to have been evolved millions of years back from the aquatic life. This venous system is still present in the human embryos. Well, what it is actually then doing in the human embryos? That is the topic of discussion today. We will see what exactly is the fate of this venous system. Hello, I am Dr. Aizaz from MedicoVisual.com. Welcome to this visual lecture. So previously we had already discussed that from the vitelline venous system, hepatic sinusoids formed and then hepatic veins formed and then this hepatocardiac channel, which is basically a connection between the hepatic veins, which is actually connecting the hepatic veins to the cardiac. By cardiac I mean the heart. So it is connecting the liver to the heart, and so that is why it is called hepatocardiac channel. And this hepatocardiac channel, it is actually the superior most or cranial most or uppermost part of the inferior vena cava. And in this lecture we will also see that how exactly the inferior vena cava develops. We have already also discussed the fate of umbilical veins, but let's just ignore it. Let's just focus only on the cardinal venous system. And by the way, you must be knowing that all the veins, they initially drain into this caudalmost swelling of the heart tube, which is the sinus venosus. Of course, there must be here the other venous swellings as well that I have just removed like this. There would be other other cardiac swellings of the heart tube that I am not shown in this 3D illustration. Now let's just remove all other things and let's just show the hepatocardiac channel because it is important and it is relevant in our discussion. And along with that, here we have the cardinal veins. So here is the anterior cardinal. So right anterior cardinal, and then there is left interior cardinal. I will just write LA, and then this is the right posterior cardinal, and here is the left posterior cardinal. Now if you focus on this diagram, you can automatically guess that upper part of the body, specifically head, neck and upper limb, that is actually drained by, in embryo I'm talking about, not in adult, it is actually drained by the anterior cardinal vein, while the lower part of the body, specifically the trunk and lower limbs, that is actually drained by the posterior cardinal veins. Now the anterior cardinal vein is lying cranially or superiorly, you can say, and posterior cardinal veins, they are lying caudally and posteriorly. But why anterior and posterior rather than calling them cranial and caudal? We have already discussed this concept time and again, but if you still don't know, please watch our video on the topic of gastrulation that is available on our YouTube channel, and I will put the link down below in the description. Now here you can see that anterior and posterior cardinal vein on right side, they combine to form the right common cardinal vein. So here is the common cardinal vein, and similarly on the left side, anterior and posterior cardinal veins, they combine to form this left common cardinal vein. Again, it is also opening like all other veins into the sinus venosus. Now let's start discussing the fate of these veins, but before I discuss that, let me put a disclaimer here that the actual things in reality, they are quite complicated. It is very difficult to explain, so I will oversimplify the thing. I will use the oversimplified approach to explain the stuff. Second is that most of the things, they are going on side by side, they are occurring simultaneously, but I will take up the things one by one so that it becomes easier to explain. So let's start the video and we will start discussing first the fate of anterior cardinal vein, and that is simply because it is easier to explain. So let's start with the easier things first. As we have discussed that the right-sided veins, they are generally favored. The left-sided veins, they are almost always tend to be destroyed. So here also the left-sided, a part of left-sided anterior cardinal vein will be destroyed. So an anastomotic channel developed to shunt the blood from left interior cardinal to right interior cardinal, which will actually drain into the heart. And after the shunt has been formed, along with that, you must be knowing that four limb buds are developing here. And here as well. So four limb buds are developing, and within the four limb buds, veins sprout into them, and these veins are called subclavian veins. They will take the blood from the four limbs. Then what will happen that the proximal part, somewhat here, this proximal part of left interior cardinal vein, it will lose its connection with the heart like this. But this part of this left interior cardinal vein will remain. Now you can see that this left interior cardinal vein, it has lost its connection with the heart. So the only way that it can drain its blood into heart is through this transverse anastomotic channel. This channel, some people call it anastomotic channel between right and left interior cardinal vein. Now, just like we had discussed the dorsal intersegmental arteries, there are also dorsal intersegmental veins. And in the thoracic region, these dorsal intersegmental veins, they are going to form the posterior intercostal veins. Now here, if we talk about the second and third intercostal vein, they will basically sprout from this remaining part of left interior cardinal vein, and they will open up into left interior cardinal vein. Now this part of left interior cardinal vein, this remaining part of left interior cardinal vein, it will form the superior intercostal vein. And the superior intercostal vein, it is formed by the union of second and third intercostal veins. You know, this lecture is a bit complicated. Even though I have tried my best to simplify it to make it easier for you to understand in my capacity, but still it is very complicated and difficult topic. So I want you to please try to understand and try to listen it and watch this lecture very attentively, otherwise you will not understand it. So by the way, here is the left superior intercostal vein, and by the way, where is the right superior intercostal vein, that I will not discuss right now. That will be discussed at the end of lecture, and by that time you will understand that why I had kept that at the for the end of lecture. So here is the left superior intercostal vein, and here, by the way, this part, this proximal most part, which is this left common cardinal vein, it is going to form the coronary sinus and left oblique vein. And it is not doing it alone. There is some contribution from the degenerating part of left horn of coronary sinus. And finally, we had discussed the second and third intercostal vein. What about the first intercostal vein? Now, first intercostal vein, you know what? It thinks that it is something special. It is number one intercostal vein. It thinks that it needs some special attention. It needs some special treatment. It has a certain superiority complex. So rather than opening anywhere else, it will try to open directly into brachiocephalic vein. This part is going to form the brachiocephalic vein, left and right brachiocephalic vein. And now let's watch the animation that how these veins are going to be formed, and then I will tell you that what veins exactly are they going to form. So this is the animation. Now if you look carefully, this is the right brachiocephalic vein, this is the left brachiocephalic vein, and this is the left subclavian, right subclavian, and here is the internal carotid, right? Not carotid, internal jugular, I'm sorry, carotid is the artery. I don't know why I sometimes confuse the artery with the vein. So this is the right internal jugular vein, left internal jugular vein, and this is the left brachiocephalic, right brachiocephalic, and here is the superior intercostal left superior intercostal vein, which is draining the second and third intercostal vein. And here you can see the first intercostal vein. It is bilaterally, it is directly opening into right and left brachiocephalic veins. Now you can understand and you can easily tell the derivatives from these veins. If you watch this without, let's go back to animation. Here you can see that, okay, let me show you exactly. Here is the internal carotid. So right internal carotid. So if someone asks you that from where the right internal carotid artery originates, your answer should be that it originates from the part of right anterior cardinal vein. And similarly, left internal jugular also originate from the left anterior cardinal vein. And now this remaining part of left anterior cardinal, it will form the superior intercostal vein. Then this transverse anastomosis, it will form the left brachiocephalic vein. And then this part of right anterior cardinal vein, which is below the junction of subclavian vein with this anterior cardinal, this part below, up till this anastomosis, up till this transverse anastomosis, it is going to form the right brachiocephalic. And this proximal most part of right anterior cardinal and common cardinal, it is going to form superior vena cava. So let's watch the animation again. So this was the fate of anterior cardinal veins. And by the way, do remember that some of the important veins of the head region that I haven't shown in this diagram, they are also derived from the anterior cardinal venous system. And second thing is that this was the internal jugular. What about the external jugular? External jugular, it actually secondarily arises from the subclavian. It sprouts as a secondary vein from the subclavian vein, right and left subclavian vein. So this is forming the external jugular, and this is the external jugular, and here is the internal jugular vein. So that was about the anterior cardinal venous system. So now let's talk about the fate of posterior cardinal veins. Now the aim of life of posterior cardinal veins is to drain the two structures. Number one is this intercostal veins, and specifically which intercostal veins? These are from 4 to 12 intercostal vein, thoracic intercostal vein. By the way, 12 intercostal vein is actually not intercostal vein because it is not technically between the two ribs. Costa mean ribs. So that is called subcostal vein. So it drains from 4 to 11 intercostal vein, and the 12th is the subcostal vein. So bilaterally it is also draining the subcostal vein in the embryonic life, not in the adult life. So one aim is to drain these intercostal veins, and the other aim is to drain the intermediate mesoderm, specifically the part of intermediate mesoderm that is mesonephros and the adjacent structures. Now what is mesonephros and what is the intermediate mesoderm? You already know these things, but just a little bit of overview that you must be remembering that if I draw the diagram, here is the paraxial mesoderm, and then there is the intermediate mesoderm. Mesoderm has been divided into different parts, and finally there is the lateral plate mesoderm. Now let's say if it is a 3D diagram, if we draw the longitudinal section here, this would be the situation. So here you can see, if you focus on the intermediate mesoderm, here you can see that this intermediate mesoderm, it is actually forming a longitudinal ridge. So this is forming a longitudinal ridge, and this longitudinal ridge is called urogenital ridge. Now this urogenital ridge, it is going to form most of the urogenital system as the name indicates. Of course, we will have a full chapter, a full course on the formation of urogenital system, but just a little bit sneak peek to really make you understand some crucial concepts here. So urogenital ridge is divided into an anteromedially lying genital ridge, and the other euro part, it consists of three nephrogenic cords, and these nephrogenic cords are: number one is the cranially lying, that is in the cervical region, that is called pronephros. One is the pronephros, and that is very primitive system, and that is destroyed in humans. There is no need of pronephros, that is in the cranial region of the embryo. Then in the thoracic and upper lumbar region is this mesonephros here, this yellow one shown here. It is the mesonephros, and that acts as a temporary kidney in the fetus, and most of it is also destroyed. Some part remains, especially in the males, but that we will not discuss today. And the third one is the metanephros, the caudalmost one. It is in the pelvic region. It is called metanephros, and that is going to form the definitive kidneys are formed by the metanephros. Now, the mesonephros, it is the responsibility of posterior cardinal vein bilaterally to drain the mesonephros and adjacent structures. And what are those adjacent structures? Here you can see this is the genital ridge. It has to also drain the genital ridge, and here is the primordium of suprarenal or adrenal gland. It has also it has to drain the this primitive suprarenal gland as well. So all these structures, they are meant to be drained by this posterior cardinal vein. Now, one thing you must understand, and I'm not just making it up, it is actually the words of Gray's Anatomy. So this old clumsy, actually these are not exact words, I have added some spice to it. So this old clumsy primitive posterior cardinal vein, it cannot take up the burden, that much burden, that it has to drain the intercostal veins, and it also has to drain the mesonephros. So this weak vein, it says, hell with this, I am not gonna drain all these structures. Please augment me with some other veins so that I can just go and rest in peace. I don't want to drain all those structures. Now, in the small animals and fishes and some other animals, this posterior cardinal vein, it is enough to drain especially the intercostal veins. The posterior body wall, it is enough specially to drain the posterior body wall, so it persists and it continues to drain the posterior body wall. But even in some smaller organism, even in some fishes, it is not able to drain this mesonephros. So to drain the mesonephros subcardinal vein, it also develops in those animals. But even in smaller animals, only this vein is enough. But human, they are complicated, they are complex organisms. They cannot be drained solely by this posterior cardinal vein, so that this posterior cardinal vein must be augmented by two other veins. I should not say augmented. Of course, initially it is augmented, but later on it is actually replaced by two other veins. One vein, it is going to drain the mesonephros, that is called subcardinal vein, and the other vein that is going to drain the dorsal body wall, that is going to drain the intercostal veins, and that is called supracardinal vein. So subcardinal vein and supracardinal vein, they are going to form, and sacrocardinal veins, of course, according to some authors. All these three veins, they come to rescue this posterior cardinal vein so that it can rest in peace, and those veins will drain the structures. So let's discuss one by one. So here you can see that at this time the posterior cardinal vein is draining the mesonephros and adjacent structures as well as the posterior body wall. But later the subcardinal vein, they arise bilaterally. So now it is going to take up the responsibility of draining the mesonephros as well as the adjacent structures. What are those adjacent structures? I mean this gonadal ridge, which is also called by the way genital ridge, and the primordium of suprarenal gland. And here you can see that venous connection, it is arising from this subcardinal vein. It is going to fuse with the venous connection that arised from this posterior cardinal vein, and in this way an anastomotic network has been established between the subcardinal vein as well as the posterior cardinal veins. Later, our transverse anastomosis is also established between the right and left subcardinal veins. So this is subcardinal anastomosis. So this is also here that is shown, and that is also established. Now from these right and left gonadal ridges as well as the primordium of suprarenal glands, both of these organs they originate. So here you can see that both of these organs they originated from these structures. And most of the mesonephros is destroyed. Actually, mesonephros is acting as a temporary kidney, but later on when definitive kidney begin to form from the metanephros begins to be destroyed. So mesonephros is mostly destroyed. So now we only have the suprarenal gland and gonads. So the subcardinal vein that was draining all this mesonephros, most of it is destroyed, and only the part of subcardinal vein, that part remains, that is going to drain that is actually draining the suprarenal gland and gonads. Other parts are destroyed. Now from metanephros, at the same time from metanephros, the definitive kidney began to arise, and now this definitive kidney is looking to drain its blood. To which vein it can drain? Although it is metanephric in origin, but it develops the vein that arises from this, which is actually metanephric in origin, and that goes all the way from this kidney to this subcardinal vein like this. And later on this kidney will ascend upward and it will come to lie in its original position. So here is basically the right renal vein, and here is the left renal vein. Now following its tradition, the left subcardinal vein is not favored, right is favored. So left subcardinal vein is also destroyed. Now the suprarenal vein and this gonadal vein, it is looking to drain somewhere. So what it will do is that it will open up directly into left renal vein. So here is the left renal vein, which is actually opening up directly into this right subcardinal vein. Now if someone asks you that what is the origin of right and left renal veins, your answer should be first right renal vein. Right renal vein, it is although metanephric in origin, but it opens up directly into the subcardinal, right subcardinal vein, which is actually meant to drain the mesonephros. And about the left renal vein, it has two parts. One part is this metanephric in origin up to here, and this remaining part, it is subcardinal in origin. So left renal vein is a bit longer and it has two parts. Now, because the subcardinal veins are there to drain the structures that are formed from this mesonephros, this part of subcardinal vein, which was meant to be formed to drain these organs, these mesonephric originating organs, it will be destroyed. It is no more needed. So this part will be naturally destroyed. And then of course kidneys will descend upward, coming to lie in their actual position. But now here is the problem. Now these subcardinal veins, these are just lonely stump of veins. Now they have taken up the blood from these organs, from the suprarenal gland through the suprarenal vein, from the kidney through the renal vein, and from the gonads through the gonadal vein. They have taken up this blood, but where they will drain? These are basically right now, they are the dead-ended veins. So where they will drain? So should they drain into this posterior cardinal vein? Of course not, my friends. It should not drain into posterior cardinal vein, because again that is old clumsy vein, and of course that is going to be destroyed later. So here they will see this opportunity. Here they will see this hepatocardiac channel, and they will build up a connection between the hepatocardiac channel and the stump of subcardinal vein. So this connection, this anastomotic channel, this communication is formed between the subcardinal, right subcardinal vein, and the hepatocardiac channel. So these three are the parts of inferior vena cava. Later we will see how inferior vena cava forms. And by the way, now the issue of drainage of mesonephros has been settled up, and now in the next part of lecture we will see that how this dorsal intercostal veins, how they are drained by the help of the supracardinal veins. Now let's talk about the drainage of dorsal body wall through the supracardinal veins. The second aim of life of posterior cardinal vein is to drain the dorsal body wall. But before discussing that, here is this remaining stump of posterior cardinal vein. It is the inferior or caudalmost part of the posterior cardinal vein. Now this is basically called the sacrocardinal segment of posterior cardinal vein. And some authors, they believe that this is not the part of posterior cardinal vein. They believe that caudal part, posterior cardinal vein, is destroyed. So a new vein develops, and this new vein is called the sacrocardinal vein. It is not said that it is the sacrocardinal segment by some authors. It is said that it is a new vein called sacrocardinal vein, and Langman embryology, it mainly follows this view. But most of the other textbooks, they follow the previous view that the sacrocardinal part is basically a segment. It is a remaining segment of posterior cardinal veins. So by the way, what happens to the sacrocardinal vein? It will further sprout the external and internal iliac veins. So this will form the external and internal iliac veins. And internal iliac vein, by the way, you must be knowing that it is going to drain the pelvis, and external cardiac vein, it will drain the developing lower limbs. Now, if you focus here, this is the posterior cardinal vein, and this posterior cardinal vein will be like, hey, you just arrange the subcardinal vein to drain the mesonephros, but here I am lying here and I have to drain all these posterior body walls, all these intercostal veins. Please do something for me. Please arrange another blood vessel. Please arrange another vein that will help me drain this dorsal body wall. And nature has decently took care of its demands. Nature has arranged another vein called supracardinal vein, and this supracardinal vein helps the posterior cardinal vein to drain the dorsal body wall. I mean the intercostal and subcostal veins. This supracardinal vein, of course, because it has to drain the dorsal body wall, so it is lying more dorsally. The posterior cardinal as well as the subcardinal, they are lying almost in the same plane, except it is lying in the medial side and it is lying at the lateral side. But this one is in the dorsal plane. The supracardinal is in the dorsal plane. And what it will do, it will drain the intercostal veins and subcostal veins. And the supracardinal veins, it first appear 2 weeks after the appearance of subcardinal vein. And by the way, this sacrocardinal segment or sacrocardinal veins, they also develop a transverse anastomosis between right and left sacrocardinal veins or segments. Then what happens that, of course, this supracardinal veins has been formed. They have been formed, so they must be taken advantage of. So these intercostal veins, they will begin to drain into this supracardinal vein. They will form the connection with the supracardinal veins. And as it happens, now this remaining part of posterior cardinal vein, it is also destroyed. It can now rest in peace because its job has been taken up by supracardinal and subcardinal veins. vein. So most of it is destroyed. The only part that remains is on the right side, which will later form the root of Aizaz vein that we will discuss later. Just like the subcardinal vein, the supracardinal vein, it also develops a transverse, it develops two transverse anastomosis. Now below this subcostal vein, most of this supracardinal, it is also destroyed because it is just not needed. So, but except the lowermost part. I don't know why this lowermost part still remains. Perhaps what I think of it is that it has developed a special affection with this lowermost supracardinal vein. So it remains there. It will say that, hey, I'm not gonna be destroyed. I will stay attached with this lonely supracardinal segments, and its demands are respected and it stays there. But now it is facing another problem. Along with the supracardinal vein, again it is just a lonely stump of venous system, and how it can drain its blood into the heart. So here it will look here and there, and it will find this lower part of subcardinal vein, and it will develop a relationship with its elder sister. It will develop the relationship with the subcardinal vein. That might sound incestuous, but that might help you to remember. So what it will do is that it will form an anastomotic channel, and this anastomosis is between the supracardinal and subcardinal vein. So now that's how the inferior vena cava forms. So if someone asks you that what are the parts of inferior vena cava, what are the embryonic origin, what is the embryonic origin of inferior vena cava, your answer should be pretty clear. You should say that inferior vena cava, it consists of 6 parts. And what are those 6? First one is this, from the caudal end I am talking about. This is the sacrocardinal segment of posterior cardinal vein, or simply sacrocardinal vein. This is one segment. The second part is this inferior most caudal most part of supracardinal vein. Then third is the supracardinal subcardinal anastomosis. Then fourth one is this subcardinal vein. Fifth one is subcardinal hepatocardiac anastomosis, and sixth one is the hepatocardiac channel itself. So these 6 parts, they are rather contributing towards the formation of inferior vena cava. So let's see how inferior vena cava develops. Let's see the animation. So like this, now we have this inferior vena cava, and here this is the right common iliac, and this is the left common iliac. If you watch the animation carefully, this left common iliac, it is mainly formed by this transverse anastomosis between right and left sacrocardinal channels. So this is the inferior vena cava, and if you watch the animation carefully, here you can see, okay, let me show you again. Here you can see that here this remaining part, it has formed the root of Aizaz vein. Now what is Aizaz vein? This is basically the Aizaz vein. Now Aizaz veins means unpaired. Zygote, zygote, it is paired. It is formed by fusion or pairing of sperm and ovum. So it is azygous. It is not in the form of pair. This one is separate and this one is separate structure. So here you can see this is the azygous vein, and azygous vein is draining the from 4th intercostal to 11th intercostal, and some people say 12th one subcostal. It is also being drained by azygous vein. And here you can see that this common, it is going into this right common cardinal vein, and right common cardinal vein is going to form the superior vena cava. So it is basically draining this azygous vein, it is draining into superior vena cava. And here this part, this is the accessory azygous, and it is draining from 4, 5, 6, 7 and 8 intercostal vein, and this part is hemiazygous. It is draining 9, 10, 11 and 12th one is the subcostal. So 9 to 9, 10, 11, and some people say subcostal. It is being drained by hemiazygous. This is the hemiazygous vein, and this hemiazygous vein is opening into the azygous vein, and this accessory azygous vein, it is also opening into the azygous vein. And by the way, this accessory is also called superior. Accessory is also called superior azygous vein, and this is hemiazygous is also called inferior azygous vein. So these things you must remember. And how can you remember that accessory is superior? You know, superior is also called anterior, and A for anterior and A for accessory. So with that reference, you can just remember it quite easily. You remember in the start of lecture, I have told you about I have not told you about the right superior intercostal vein. Now it is the time that I should tell you about the right superior intercostal vein. So right second and third intercostal vein, they are lying here looking to be drained somewhere. So what they will do, they do not have a luxury to be drained in their separate superior intercostal vein. So what they will do, they will join their hands together. They will unite to form the right superior intercostal vein that will drain into the root of azygous vein. And by the way, just remember that root of azygous vein is formed by the remaining superior or cranial part of right posterior cardinal vein. So this right superior costal vein, it usually drains into the root of azygous vein, but sometimes there is a variation seen, and it sometimes drain into right brachiocephalic vein, but almost never into superior vena cava. Superior vena cava thinks that it is something superior, and it says that I don't allow these small tiny intercostal veins to be drained into me, so you just have to drain into this root of azygous or into the right brachiocephalic vein. Now you remember that the intersegmental vein, dorsal intersegmental veins, they are not just in the thoracic region. They are also present in the lumbar region, and in lumbar region they are going to form the lumbar vein. Now the lumbar vein, they are the lumbar analog of intercostal veins. So these are the lumbar analog of intercostal veins, and usually we have 4 lumbar veins. Now lumbar veins will feel that they are sort of left out of party. So what they will do is that they will join their hands together, and they will form a vertical anastomosis with each other. They will form a vertical anastomosis with each other, and this vertical anastomosis will then further sprout upward and downward to form what we call as ascending lumbar vein. So here you can see that ascending lumbar vein has been formed. Now ascending lumbar vein, superiorly cranially, it is connected to azygous vein and hemiazygous vein, and inferiorly it is connected to the right and left common iliac vein. Now this is something interesting here. You can see azygous system, it is superiorly draining into superior vena cava, and inferiorly it is draining into common iliac veins, which are basically the tributaries of inferior vena cava. So basically it is connecting the inferior vena cava to superior vena cava. It has a very important functional significance. What is that? Actually, what happens that if somehow the inferior vena cava is blocked, the blood that was destined to be drained into inferior vena cava, it can move through the azygous system, and it can be drained through the superior vena cava into heart. The reason is that this azygous system of blood vessel, it has very few valves, and it can allow the backflow of blood. Similarly, if somehow the superior vena cava is blocked, this blood can backflow into the inferior vena cava. So it's an important collateral system between superior and inferior vena cava. So this was about the fate of cardinal veins and the formation of inferior vena cava. Thank you so much for watching this video.